And we're just going to move right along. We have a keynote from Carol McGruder. She is a seasoned veteran of California's Tobacco Control Experience member and co-chairperson direction of Tobacco Control Policy, Practices and Priorities. The AATCLC works at the intersection of public health policy and social injustice. They have fought resolutely against the decades of racialized and predatory tobacco industry targeting of the Black community and the resulting 45,000 Black lives lost each year from tobacco-induced diseases. Oh, we're going to have a deep conversation. Please welcome Carol McGruder.
Hello, Nikki Thomas. I haven't seen you in a long time.
How are you today?
I'm doing fabulous. I'm going to share my screen. Okay, you can see it? Somebody say yeah.
Yes. Mm-hmm.
Okay, so hello everybody. I'm happy to be with you, my Bay Area people. Can you hear me clearly? I'm coming here from Columbus, Ohio.
Yes, I can.
Okay, wonderful. So we are, this election, we've have some ups and downs as we always do. One thing that we can be glad of is that we passed our Proposition 31 in California, making California the second state after Massachusetts to take menthol, Newport cigarettes, and flavored combustible tobacco off the market. So I just want to say we did the damn thing. We worked hard on this, and the epicenter of this movement is coming from the Bay Area. So many of you on this call, you've been pulling the rope with us, rowing the boat. And so we have a big accomplishment today that moves us forward, a big giant step to get these deadly addictive products out of the Black community. So these are the results so far. Not all the votes are in, but it was called. And so we have 62% of Californians did not go for the okey doke that the tobacco industry cartel tries to do when we're trying to protect public policy, public health. And so Californians were not fooled. And the interesting thing about this is that once the tobacco industry collected the signatures to get this on the ballot, because we did pass a law already in 2020, it was like an orphan proposition. They didn't put money into it. And so, one of their tactics is to delay. But they also probably did some heavy polling and they could see that they could not win it. But we had to fight, and we did fight the good fight across this state. This past year, we've been fighting this fight. This is the map showing the breakdown of the vote. And you can overlay a lot of things on a map like this, including disparities and where some of the hot spots are. So you'll see that the darkest green there, aquamarine, is the Bay Area. And that's where we had over 70% of folks voted yes for life, yes to take these products out of our community and out of the state of California. So just hugely proud today and feeling so grateful. And this is a breakdown by county. And so the significance of this for me is that you see Los Angeles had 63% a yes vote, and LA, because of the racial overlay that I'm going to talk about, LA is one of those cities where we just were hit so hard with police brutality and many different civil unrest issues. And so Southern California came out strong, LA came out strong, 63%. We see San Francisco at 78%, Alameda at 73%. So this is very significant and we should all be proud of the Bay Area, because so many of the good things that do come out for our folks are coming out of the Bay Area. Let me see if I can get this to go forward. So I'm the co-chair of the African American Tobacco Control Leadership Council, and we are all over the state of California. We have been meeting monthly with no money for the first 3 or 4 years, no funding since 2008. And we roughly have the same folks that we started with. We have some people who've retired. And I was listening when Sister Harper was on and talking about the funding streams. And so I really want our people to know that we do this work because we are compelled to do that. No one loves a Black menthol smoker more than the AATCLC. That is why we exist. We started this organization with our own funds. It's been our own funds for years before we got any type of public funding. And my people know that I would be there with or without a grant, because this has been one of the most important issues that I've worked on in my career. And I have worked on HIV/AIDS, I've worked on Black infant mortality, maternal health. And so I've worked on many things, but the commercial tobacco control just took over, because this was like the orphan child that there was not enough attention being paid to, when it is the #1 preventable cause of death for our people, killing more than everything else combined. And there's a vector for that, and that vector is the tobacco industry cartel. So we are the giant slayer. The giant is still alive. We're not fooling ourselves that the giant is down, but we're making some inroads. And so the way we bring this giant down is that everyone has to be empowered to do their part, to get a leg, to get a knee, to get an arm, and we bring them down. And I think the phase we're at right now, even though it's feeling great, our success that we had is we have poked a bear in the eye with a stick. And so you know that bear is going to start fighting and swinging. So we don't know what the bear is going to do next. The bear could have a lawsuit to block our referendum that we just voted overwhelmingly that we want for the state, or they're all over the country, as I'm in Columbus, Ohio right now, trying to salvage and keep what they can. So the giant's not down till it's down, and it's still not far from down, but we've made some great strides, and people need to understand where we are and where we go next. So tobacco, of course, is a major driver of all health inequities and disparities. You cannot talk about any of the other things that impact Black folks without seeing the influence and the effects that tobacco has on that. Whether it's low birth weight babies, or SID, sudden infant death syndrome, whether it's asthma, and I do environmental work. So when you combine exposure for children to secondhand smoke and thirdhand smoke, combined with the air quality at the port in West Oakland that our children who live there, or where I grew up in Baby Hunters Point, we have the wastewater plant there. We had slaughterhouses when I was a child growing out. So when you combine all those environmental factors, then building the freeways through our communities, then combined with the second and third hand smoke that our children are exposed to, then all that increases inequities and increases disparities. Diabetes is very much stress related. Most diabetics who have an amputation, there's smoking involved with that. You have double the circulation, because smoking also cuts down your circulation. So when we think of diabetes and when you see those amputations, it's usually the smoker, then cancer, of course. And so we think of lung cancer as being related to tobacco, but there are many forms of cancer that are caused by smoking, or smoking worsens it. And imagine a person who's trying to heal from cancer, who's a smoker or who lives with a smoker. The cardiovascular diseases, environmental pollution, our mental health, that we think of nicotine as a stress reliever. Many people smoke because of that, and that's a brief stress, but then nicotine is actually brain poison that's masquerading as stress relief, and it actually increases your anxiety in many ways. So to President Barack Obama signed the Family Smoking Prevention Act in 2009. And at that time, menthol was taken, all the flavors were taken out except for menthol. You can see I'm excited today because my words are jumbled. So all the flavors were taken out except for menthol. Menthol was given a pass, and that was because of the backdoor bargaining that happens when you're making a law, and menthol was one of those bargaining chips. So the exclusion of menthol was not based on science at the time. It was just simply a deal. And that, when we call that trickle-down public health policy, when you improve the health for those at the top who can fend for themselves better than we can, and then hopefully something might trickle down to our community. So at the time, we knew that flavors hook children, that it was an initiator, Menthol numbs the throat. It's an anesthetic. It stimulates parts of the brain. It dilates the alveoli in the lungs, so it allows the toxins to remain in the lungs deeper and longer. And people initiate smoking with menthol. So some children were protected, but not Black children. These children were not protected. And there's talk about that some of our smoking prevalence is because of bad parenting, and that if we were better parents, that our children wouldn't do certain things. And so this child needs more protection from society, not less. If that's your viewpoint, then those children actually need more help and more protection and more public policy. So we know that when there are jokes on with Dave Chappelle, Saturday Night Live, why do Black people smoke menthol? Why do they smoke Newports? And the reason is because we were perniciously targeted to do so for decades. This is an abstract that we submitted 10 years ago in Singapore at a conference, documenting from the tobacco industry cartel's own internal documents how they went after African Americans, and they increased the market from 5%, which is what it was when they started these tobacco wars on us, up to over 85% today. So that's the reason that Black people smoke mentholated tobacco products, and why we are particularly going after that. We're not advocating that people switch to a non-mentholated product. We want our people to quit and get off of these products, but we're starting where the fire is, and the fire is with menthol. When you put out a fire, you go to where the fire is. So this is where the fire is in our community. This is the poster girl for that targeting. Marie Evans grew up in Boston in public housing, and these were programs that happened all over the country, in every major city in this country. Given Newports at the age of 9, where she traded for candy, addicted at 13, dead at 54. And her family was actually awarded $152 million, of which they received $79 million in a settlement. And so the value of a Black woman's life from a jury in Boston, what are the millions of Black people who have died from tobacco induces? What does our community do for that? And we're going to talk a little bit about that. So Dave Chappelle is the most famous person that we know, given free cigarettes in Washington, D.C. in the metro when he was 14 years old. This is a photo that I dug up of him when he was 18. So you can imagine how young he looked. He was a kid when he was given these deadly addictive products, of which he's still fighting that battle. So tobacco is a social injustice issue. We want to say that the industry targets everyone. That's their specialty of segmenting populations, but they're particularly pernicious in our community. We have so many other issues to deal with, so that they have gotten a pass all of these years because we've been concentrating on trying to survive and fighting for civil rights, civil unrest, all of the things that keep us busy. And then the tobacco industry is there to seed these seeds of addiction in our community, and we're living with that legacy. And so Prop 31, the passage of that yesterday in California, is so significant for our community and for what's going to happen with our health in California and in the rest of the country. So it's the beginning of a bigger fight, but we're down for that. And so we know that doing nothing, is not an option. So when people talk to you, you're going to hear, as we ramp up, the industry is ramping up, and you're going to be hearing more and more. And you'll hear that when someone starts the conversation with an elected official or a leader, well, they don't like smoking, or they're not advocating that people smoke, and then comes the but. That's usually an indication that that person is receiving some money from the tobacco industry. And so one of the things we want our people to do is for people to disclose when they come before us as leaders, as people who are hosting forums, community forums, they need to disclose right off the top if they take money from the tobacco industry cartel. So that's Reynolds American, which is Newport cigarettes, Altria, Philip Morris. So they need to disclose that. And sometimes they'll have a little RAI. They've taken it off now, but they used to have RAI on a flyer because nobody knew that RAI is Newport cigarettes. So we want to, that needs to be disclosed. So this is an op-ed that our council member, Dr. Valerie Yerger, who's a professor at UCSF there with Dr. Rhodes, an editorial from the latest research that we have quantifying just how many more Black lives have been lost because of the delays. And that's what we don't want, any more delays. Now we passed the law already. The tobacco industry put it on the ballot in California. Californians have spoken. Now we want the stuff out of our community. No more delays. So when you have delays, a year, 2 years, 3 years, 5 years, 10 years, that's millions of more people who are going to be addicted to these products. And so this latest research that was published by Doctors Mendez and Thuy Lee talked about the consequences of a match made in hell, and how between 1980 and 2019, we've had 1.5 million new African American smokers, people who would not have smoked if menthol had been taken off of the market. We've had 157,000 more smoking-related premature deaths among African Americans, and we've lost 1.5 million life years since 1980 to 2019. And so right now, we want to say right now, these products come off right now, and we begin the work to heal our community from this pernicious racist targeting that we have endured for all of these decades. So our organization actually has filed a lawsuit with the FDA. So this fight is on multiple levels. There's our city fights. So in the Bay Area, San Francisco, Oakland, Berkeley, San Leandro, they had already passed laws to take these products off the market. Now we have the state. So California and Massachusetts are the two states who've taken it off. We're also working on the national level, but we do not wait because we know that the tobacco industry delays and delays and delays. So this lawsuit, which is still in play, was to compel the FDA to take these products off the market. These are the co-plaintiffs who were with us on the lawsuit: Action on Smoking and Health, the American Medical Association, and the National Medical Association, which is our African American doctors. So the FDA is right now at this moment in the process of making a rule to take these products off the market. So they had the initial rule, there were public comments, they pull it back in, they will issue a final rule, and there'll be public comments. But in the interim, then there's all this fighting going on to block it, possible lawsuits. So we need the community to know that we keep going until it's done. And then even when it's done, there are things that we need to do, because we need to help our people to get off of these addictive products. We need to have services for them. And that's what we are all working on right now. So if the rule goes into effect, then they would take off menthol cigarettes and all flavored cigars. Now this has gotten less play, people don't realize it. So that's your Black and Milds, your Swisher Sweets, your Backwoods, those are coming off of the market as well. And I know that the young men, my stepson's age, they're not going to be happy because they pat us on the head and as they smoke these products. Those are also coming off the market too. So African Americans have been used as a tool to blunt public health policy for us and for everybody else. The tobacco industry cartel, they cynically exploit our legitimate grievances of racism, police brutality, officer-involved shootings. This was from 2016 when Reverend Al Sharpton had a meeting there at Beebe Memorial Theater, and we were a church cathedral, and we were all there that time, myself, Dr. Val, and Dr. Phil, and able to hear Reverend Al talking about posing the question of what's going to happen to our community. And so this is a picture from Stephon Clark, a boy who was killed in Sacramento. And so these incidents happen, and we have to push forward with police reform and the reform of the effects that the tobacco industry cartel has rained down on our community. This is Eric Gardner, the case, Black Lives Matter, that ignited that catalyst, choked to death in New York for allegedly selling a single cigarette. So we're seeing the use of these images and these incidents, because they are real incidents. We do have an issue with police brutality in our country, but we cannot let that be used to stop us from dealing with the #1 targeter, the #1 profiler, the #1 killer of our boys and men, which is the tobacco industry cartel. This is a close-up of this boy who was assaulted in Rancho Cordova. I'm going to speed up a little bit because I know my time is going. So we want to say that healthy communities facilitate the individual's ability to make healthy choices. A lot of the things that we do are geared to an individual, but it's about changing community norms. It's about having a supportive environment that's healthy and thriving, and then people are less likely to make these individual horrible choices that we have. So the Titanic is going down and we want to get our people off of there. We are their lifeboats. And so we need to address the social determinants of health. We need to change social norms. We need policies. We need laws, which is what we passed yesterday in California. And we need relevant education and true community capacity building and power building. And I know Dr. Kim Rhodes, some of the programs that she's doing, that's what that's about. It's about building capacity in our community, providing jobs, providing education in a meaningful and relevant way, support for people that you can affect change on your community. And that's where we're about. So before our last presidential election, there are a lot of people who talked about reparations. There was a lot of blah, blah, blah. Everybody was for it. And once that election happened, we haven't heard that much about it anymore. So our position is that African Americans, that we're a protected class. We need to be protected from the tobacco industry cartel by our government. We've just been left out there to hang. And what the industry does actually violates the International Convention for the Elimination of All Forms of Racial Discrimination. We have actually taken our case to the United Nations, and these are some of the next steps that we're hoping our community will participate in with us. So our website is savingblacklives.org, and you can go on the website and sign up. We have a petition there for the UN, and we're also going to be working with municipalities to enact resolutions saying that we African Americans, that we need protection from the industry. And so we know that the industry is not just going to give up because they lost California. This is an example of that influence that we talk about. So this is a Detroit pastor. This is recent news that he was offered $250,000 to oppose menthol cigarette bans in Detroit, Pastor Sheffield. And so he went public with that. And so we will be seeing a ramp up of these types of activities. This is a public community meeting that I went to in Mount Vernon, New York, with Dr. Ben Chavis, who is the head of the National Newspaper Publishers Association. So is menthol cigarette ban the new stop and frisk? Well, of course, when you talk to a New Yorker about stop and frisk, you have a visceral gut reaction at the indignities that our boys and men suffered at the hands of this practice that went on for, I think, 5 to 10 years there in New York. And so what we're doing with menthol and Newports, it is not about an individual. A policeman is not going to ask somebody if you're smoking a menthol or a non-menthol. It's about the sale of these products. It's about the retailer. And more important than the retailer, it's about the manufacturer. And that's what the FDA there will be no more sales of this product at all in the United States. And that's something that we're still much fighting for and is still in progress. So I just want to say, so Dr. Ben Chavis, who takes money from Reynolds American, it's on their website, RAI, which is Newport Cigarettes. So he's the head of the National Newspaper Publishers Association, which is like our Associated Press. And they actually filed an amicus brief with Tobacco Free Kids, talking about what the industry has done to Black people, yet they take money from the industry. So this is some of the tobacco industry documents that they used in their amicus brief, talking about Newport cigarettes, and that the base of our business is the high school student. So this is back in the 70s, when they knew they were addicting high school students. So by definition, that's someone who's under 18 years old. Yet they continue to take money from this industry that's killing us. We want to focus our attention on the actual management team. So these are the people who write the checks to the people in our community who show up to espouse the tobacco industry rhetoric. These are some of them, the management team, people who probably belong to country clubs and have very good lives at the expense of all of the money and the lives that are lost in our community. This is an article from the LA Times of how big tobacco uses George Floyd, Eric Gardner to stoke fear in our community among Black smokers. So we want to talk about this. We're winding this down. And so California now, we have entered into an era of what we call the end game, and that's to change the structure. So when we think about equity, it's about changing structures. And so we want to change the structure, we want to change the politics, and we want to change the social acceptance of tobacco, period. And that includes e-cigarettes and vaping. We want to end the sale of all commercial tobacco products. And so those are the next steps. And the interim of that, we have services that we fought for our people. One of this is Amplify. This is our African American Coordinating Center. Amplify.love is the website. And so we encourage folks to get on there and look around. There are many things as we tie the issues of tobacco control to the greater issues affecting our community. And we have some cessation, some stop smoking services on this website of hooking people up with what we call culturally tailored, culturally appropriate services for our people. This is our website, savingblacklives.org, and we encourage you to sign up to get our newsletters. This is a local project in Sacramento, Soul, Saving Our Legacy. So there are just lots of resources that are available now to get this fight done. This is a fight to the finish, and we will not stop until we're done. So what you can do is you can support local efforts to ban menthol. You can support formal governmental protection from the tobacco industry cartel. So that is the next thing that we're going to really be concentrating on, is to get our local governments and our federal government to protect us as a protected class. We want to pressure our Black leaders to reject the tobacco industry. Many of our elected official groups, they are still taking money from the industry. And we want to support the FDA's rulemaking process on menthol and little cigars, which is still in progress. And with that, I think I'm out of town. So we know that passing laws to protect Black people, it marks the beginning of real change. Passing a law is not magic. We voted for the Voting Rights Act. We've been working on that for about 50 years, and we see that we still are working on our rights here. So we must work on the demand side. We need health equity reparations. We need all of our community supporting our smokers, all in supporting smokers, and for us all to deal with our own issues that we have collectively as a group. We need culturally tailored smoking cessation that addresses the social determinants of health and the political determinants of health. And we need innovation. We need innovation, and we need our young people to be involved in this. So there's that Voting Rights Act. We're still working on that, and we will be working on this, and so stay tuned. And I want to just thank all those on the call who have been in this fight with us, and the fight goes on.
All right. Thank you, Carol McGruder. Very, very eye-opening session there. I love that you had a list of things that we need to get us all into action so that we can be clear about, how we move forward. From this point, we do have some audience questions. If you have a few more moments, how can we sign the petition? That is one of the questions that we have.
So please go to our website, which is savingblacklives.org. We were Saving Black Lives before Black Lives Matter, because we've had that website for a long time, that Black Lives Matter. So go to our website, savingblacklives.org, and sign up, and we'll get you all the information.
Mm-hmm. All right. What kind of health professional education / resources do you recommend for students in nursing and physician assistant programs?
Please, I'm going to put, so my email is cmcgruder, CMCGRUDER@usa.net. Please email me, because we have so many things coming up. The funding that our state is giving out now, it's all about internships. It's all about helping our professionals as well to get the message out. And one of the things I'm here in Columbus, and I need to run across the street to the city hall, is that we want our doctors and nurses and Kaiser, they have the screening question, are you a smoker? But when you're including that medical information, include the political information. so that it's not about just a health intervention that's neutral, like, did you get a mammogram? Do you go for a walk? It's about, do you know that the tobacco industry has targeted your people for decades, and that these are the things that are happening in your community? And once people begin to become more aware of it and see it, then they'll see the effects of it everywhere, and that's very powerful. But yeah, so please contact me and I can get you some information, and we can get you into our collective as well. And then there'll be lots more opportunities for people who are interested in public health, who are interested in this field. There'll be lots more opportunities coming up to increase our presence in the field. And so, and I liken public health to the criminal justice system. In the criminal justice system, we're the defendant, and in the public health system, we're the patient. And so that needs to change.
So we have all the information there, how we can jump on board, how we can get more information, how we can stay in touch with you. You know, we can maybe just send you an email and say, hey, sis, put me to work. And
Yes.
We thank you so much for your wonderful presentation. And again, for opening our eyes to quite a few things. Carol McGruder, thank you so much for being with us.
Thank you. And I really want to thank the California Black Health
Wonderful.
Network as well. Thank you.